everyone. Hi viewers. Thank you so much for joining with us. And we have a very special guest today with us. And I will be sharing a screen just to describe about her. And we welcome you wholeheartedly, one of the best nephrologists in India, Dr. MuthuJayaraman, Senior Consultant nephrologist, Bharti Raja Hospital. She is currently at and DM Nephrology, MD General Medicine, formerly professor and HOD of nephrology at Stanley Hospital. Today, she is with us on giving an awareness on kidney health. I'm so excited. I'm so jubilant to receive wisdom and knowledge on kidney one, how to take care of the kidney so that we can take care of the kidney well and we can have lead a healthy life as such. So I would like to hand over this stage to Dr. Muthu Jayaraman to share few insights on this program, please.
Thank you, Abraj, for asking me to share with you some of the facts about kidney health and in disease also. It's a very important subject today because the kidney diseases are increasing in number. And recently, every 10th of on 10th of March, we celebrate World Kidney Day, mainly to spread knowledge about kidney in health and disease. We did it March, last 10th of March. Thank you for asking me to participate in your video talk. You can ask me any questions and I am ready to answer on that subject.
Thank you so much, Doctor. And this is the agenda we will be going through it. And basically, what is kidney in health, structure, and function, kidney diseases, what is my chronic kidney diseases, kidney function measurement, kidney failure, are you at risk of kidney diseases, take care of kidney prevention. So these are all the subject our doctor will be mulling over on this topic as such. Let me start with the question, doctor. What is mean
Yes.
by normal kidney and how does it work? What is nephron and what is mean by function of kidneys?
Broad, we have two kidneys on either side of our back of the abdomen, on either side of the vertebral column. It is supplied by main artery called aorta, and it receives 25% of our blood supply, cardiac output, every minute. Next to the brain, kidneys are the most well perfused, and it is situated here, and it removes all the waste products. It has other functions also, and it is thrown through the ureter. This is called ureter. There are two ureters, and come into the bladder, and the bladder throws it as urine. So it filters every day about 250 liters of blood and throws out urine as 1,500 to 1,800 ml of every day. That is the structure of the kidney. The basic unit of kidney is called nephron. And every kidney has a million nephrons, and it has a structure called, this is the glomerulus, and here the blood comes through the arteries, and this is a main filter. It filters uh, blood without blood cells and the plasma, and all the waste products and the blood urine comes through the water comes through that, and this is called tubules, and these tubules absorb whatever is needed like water, essential minerals and other things, and does not excrete and throws into the tubules unnecessary waste products in our body, and these are collected. As I told you, they all go into the kidney and is thrown out as urine. This is the basic unit. You can say the soldier, and kidney is the big factory to do all these functions. And the function is one of the important function I told you is filtration of waste products from the blood. And also tubules, I showed you the tubules, and they reabsorb the useful substances from the filtrate, and also secretes unwanted substances back into the collecting tube. But it is also an important organ to maintain our normal blood pressure by producing hormones called renin, angiotensin, and other substances. And that's how our BP to be kept normal, the kidney should function normally. In all the kidney diseases, you will see blood pressure is high, hypertension is there. Another important thing is it produces a substance that keeps our hemoglobin normal. Hemoglobin is the basic unit of our blood. If it reduces, we call it anemia. You may be familiar with the term anemia, that you don't have enough blood in your system. And to have hemoglobin adequately, we need a kidney function. So, kidney has multiple functions to keep our body system in a normal way. Next question you asked.
Yeah. What are the
And
diseases and what are the disorders of kidneys, doctor?
uh, our kidney, you may be born with kidney diseases. I mean, you may be born or you develop kidney disease in your childhood. These are some of the problems of uh, kidney disease in children, where there is abnormal structure of the kidney. There is the kidney may be single. Many about 5% of the population may have a single kidney, and otherwise one kidney may not be functioning well. We call it renal dysplasia. And there's a dysplastic kidney. They may be born with kidney failure, and there may be double kidneys, and the kidney may be united like a horseshoe in the bottom, and there may be a block in the kidney urinary tract, and they are born with the congenital nephrosis. These are common in children. About 5% of kidney disease, total kidney disease, are in the children. And besides, they have a adult disease like glomerulonephritis. These are the diseases of the children. Next is adult. Um, Adults have certain diseases. We call it acquired. It comes later in our life, in our adulthood. One of the common problem is diabetic nephropathy. And diabetes, when it's there for long, not controlled, it affects the kidney, and we call it diabetic nephropathy. That is the commonest cause of kidney failure today in these days, because as you all know, India is the diabetic capital, and diabetes is so common, and they live longer with the best treatment, and that leads to renal failure, renal disease. The other common cause is primary kidney disease. Kidney disease can come in the kidney itself, um, various due to various immunological problems. Then otherwise the blockage of urinary flow through the ureters called that, and result in enlargement of the kidney called hydronephrosis. And the kidney may be affected with interstitial nephritis. And stones, kidney stones are relatively common, particularly a painful disorder in our country. And certain areas in our country are prone for kidney stones. We will describe it later. And there may be tumors of the kidney called Wilms tumor, renal cell carcinoma, malignancy can occur. And that's a different subject altogether. And next, the other causes are called lupus nephritis. I'm just mentioning the name. Some of you who have suffered with kidney disease may know the name of them, identify with that. There are other diseases called lupus nephritis, minimal change disease, and nephrotic syndrome, where you lose lot of protein in the urine, and that progresses on to renal failure. And kidneys may be infected, and this is called pyelonephritis, and that is one of the common complication of what is called urinary tract infection. You know, infection in the urinary tract called dysuria. And these diseases, when not treated well adequately, they may end up in renal failure, and there may be acute renal failure, sudden loss of kidney function due to various causes, and another common cause is chronic kidney disease, and that is what we are going to describe today mainly.
So thank you, doctor. And what is CKD, chronic kidney diseases? How we can assess the function of kidneys? What are the stages of CKD, doctor?
What is CKD means? Any kidney damage, if it is present for more than 3 months, whether it is in the structure or in the function of the kidney, which decreases GFR, that is, it decreases the function of the kidney, It may be identified by due to tests or by images by taking an ultrasound or an X-ray and all, or by looking at the blood or urine, any abnormalities in imaging. If it is present more than 3 months, it's called chronic kidney disease. It may be due to various diseases, but when they are lost for more than 3 months with these um, symptoms, it's called chronic kidney disease. And the kidney function, major function, is measured in terms of GFR. That's called glomerular filtration rate. When the GFR is less than 60 ml per minute, it is called CKD. Normally, the GFR is measured by what's called creatinine clearance, shortly called as CCR. There are very many formulas are there, and now we easily measure by a test called EGFR. It is a estimated glomerular filtration rate. That's a short expanded name of GFR. And that is every lab we tell them to do that because it is not a special test, it's a calculation that tells us the amount of kidney function the patient has. The normal GFR is from 90 to 120 ml per minute. And according to the fall in the GFR, the chronic kidney disease stage from 1 to 5 according to GFR. And early detection of kidney disease is possible even before the GFR fall by a simple lab test by doing urea, creatinine, and urine protein. If your urine has any protein in the urine, that is albumin, or if your urea and creatinine are increased, that means you have a kidney disease. A simple test. Very often kidney disease are silent, and if it is done routinely, you'll be able to identify the kidney disease very early. What's a kidney failure is when the GFR, that's the glomerular filtration rate, falls below 15 ml per minute. Normally it is 90 to 120. If it falls below 15 ml, that's called kidney failure. That's a stage you have to replace the kidney function either by dialysis or transplantation. When these two are not possible, now we have started what is called a palliative care or supportive care for these patients. This is a chronic kidney disease. And I told you about the stages of kidney disease. That is according to the GFR. If it is between 90 and 120, it is called kidney stage 1. Kidney damage may be there, but the kidney function is normal. There may not be any symptoms. It's very early. But it has started as, if you look at the urine, it may show a protein. But the kidney function is normal. If it is 60 and 90, it is called stage 2. The kidney damage is there, but there may be a slight indication for the kidney disease like proteinuria, raise in urea, creatinine. Stage 3 is 30 to 50, 59, and that has they start presenting with all the problems of kidney disease I will describe right now. And stage 4 is between 15 and 30, 29. The pakka kidney disease problems will be there, whatever may be the patient. And stage 5 is what is called end stage renal failure. That is the time you have to go for either dialysis or transplantation. That is the stage called stage 5 or end stage renal failure. Next. So if you look at how many people are suffering from kidney disease, chronic kidney disease, I'm not talking about other diseases. There's 19 million Americans have kidney disease, and of them, 435,000 have end stage renal failure. That is end of stage 5 renal failure. And the mortality, that means death rate amongst this group is 24%. In India, chronic kidney disease, there is a project called Seek India, which assesses the number of, it's not very accurate because many of us don't report the disease. It's about 17.2% of the population seem to be having chronic kidney disease. Globally, it is around 8 to 10% of the population. 1% of this population go into CKD, go into ESRD, that is called end stage renal disease. And only 10% of this group, this ESRD people in India are able to get dialysis or transplantation. And right now, we have about 4 to 4 lakhs of people needing dialysis in our country. This is the estimate of uh, renal failure in our country. Next, renal disease. So what are the common causes of the chronic kidney disease? As I said earlier, when I started my study in nephrology, it used to be glomerulonephritis. But now, nearly 30 years after my primary education in nephrology, the diabetes has taken over in producing renal damage. 39% of patients of CKD, chronic kidney disease, are due to diabetes. Next is hypertension, blood pressure, high blood pressure. At 28% of chronic kidney disease is due to hypertension, high blood pressure. Only 13% due to the primary glomerulonephritis. I described so many diseases. And congenital, people born with, I told you about earlier, about the cystic and congenital renal disease forms 4%. Another group of nephritis called interstitial nephritis or infective nephritis is 4%, and tumors and neoplasm are due to 2%. But remember, the major cause of chronic kidney disease in our country is diabetes and high blood pressure. Next.
Thank you, doctor. What are the common causes and symptoms, and how to identify the kidney problem ahead of time?
I just not told you about the causes. So people with diabetes, high blood pressure must have, and after age of 40 or 45, when you have more than 5 years of diabetes or hypertension, you need to have a routine checkup. It may not have any symptoms. But once symptoms occur, the kidney damage is little severe, probably CKD 3 or so. The common symptoms are swelling of the legs. The swelling of the legs not permanent. Initially, it will start when you travel, when you sit long, because the computer guys sit at the table for more than 12 to 16 hours. Morning they'll go well, but evening the shoe will be tightened. They will be finding it difficult to remove the sock. The edema, that's called edema, water retention in the body. Or your face may be puffed up in the morning. That is one of the early symptoms. And tiredness and malaise. That is, you feel very tired and you are not able to do your normal work as usually. And third is a decrease in the urine output, which you may not notice. Very many people tell me that, no, I pass urine 3, 4 times or 2 times at night. But they may not know the quantity of the urine passed is less. We call it oliguria. We pass, as I told you, 1,500 to 1,800 ml of urine per day. And this may be less, but you may pass urine 4 or 5 times. Another symptom is nocturia. Nighttime, most of the younger people below 45 or so won't pass urine. Once they go to bed, they will get up in the morning and pass urine. But once kidney disease occurs, many of them start nocturne, night urination, and that is one of the symptoms. But not every winter, when you have AC and all that, you may get up in the night and pass urine. But one of the early symptoms are, now we call it nocturia. And number two is gastrointestinal abdomen. Appetite may be less. We call it anorexia. Appetite may go down, and nausea and vomiting. Patient, you don't have a desire to eat, you feel like nauseated, you feel vomiting, and this way you don't feel like eating. That is another symptom. And skin may have itching, and you may become pale because you have become anemic. And eyes, if it is a diabetic patient, if you develop kidney problem, your eyes also will be affected. We call it diabetic retinopathy, and your vision may be affected. And cardiac problem, kidney disease is one of the common cause of heart cardiac problem. Most of our kidney patients don't die of kidney failure, but they die of cardiac problem. One is a hypertension, the blood pressure may be the kidney may be the cause for the high blood pressure. They may lead to heart failure. coronary artery disease, that is heart attacks, ischemic heart disease, pericarditis, etc. And when it's advanced renal failure, patient may develop convulsion, fits, seizures, and other neurological problems. So these are some of the symptoms. They are not early symptom is developing uh, leg edema or facial swelling and tiredness and increase your BP start going up and loss of appetite, etc. But so many symptoms may occur after and the kidney disease advances. Next.
Yes.
So one thing you have to remember, kidney diseases are common. They are not uncommon because unless we look for it, when we start looking for it, you will know understand the commonness of it. It is harmful because very often if you don't identify, if you don't treat, it leads to ESRD, that is end stage renal failure, premature death, coronary heart disease, strokes, and may lead to renal replacement therapy. But one thing you also understand that it is treatable. If you treat it early, you can, it's not treatable, not completely may not be curable, but very often treatable. Early detection, appropriate management, following diet restriction, regular follow-up, and other conservative treatment retard the progress of the disease from stage 1 or 2 to stage 5. And very sometimes you may get a complete cure. Very few kidney diseases you may get a complete cure. And fourthly, if you avoid unnecessary medications, it is very easily you can arrest the progression, particularly like alternative medicines, native medicines, and Siddha, Ayurveda, and all those kinds of the medicine. We do not know how do they act. We know allopathic medicine, sorry, they are harmful to the kidney and we tell the patients. But we do not know about the other group of medicines, how whether they are harmful to the kidney. But very often we find people taking Siddha, Ayurveda, homeopathy, and etc. coming with kidney diseases. So you better avoid unnecessary, unknown medications. Next. So, certain important facts to remember, early stages of CKD has no signs and symptoms. Unless you start screening the patient, looking for the regular medication, a simple test like urine test or blood urea creatinine will identify the early stage of CKD. And CKD is not usually reversible. You can't become a diseased kidney of stage 3 or 4, cannot bring you to normal. But that you have to remember, it may be a hard fact, but you have to understand that. And so start early treatment. What does the regular treatment does is it slows the progress. It slows the progress from stage 1 to stage 5. It may take 20 years sometimes to reach if you don't, if you take care to reach a stage 5. That's good enough. But if you don't take, if you are very careless, if you don't take your treatment properly, it may be in 5 years. So that remember that it can slow the progress and sometimes arrest the progress of the disease. It stops at stage 3 itself. So this is another important factor to remember. If you allow the chronic kidney disease, CKD to progress, it ends in end stage renal failure. This is some of the important factors you need to remember. Next.
Thank you, doctor. Thank you, doctor. What are the CKD and treatment? What is mean by dialysis, doctor?
Kidney failure, it's otherwise called end stage renal failure or CKD5. When we say kidney failure, that means both kidneys are damaged beyond repair and the EFR is less than 50 ml per minute. If one kidney functions well, it's enough to live normally. That is up to GFR 50 ml per minute is patient is asymptomatic. That's an important fact to remember that if you can, that's a fact basis of kidney donation for transplantation. If you are well, your both kidneys are functioning well adequately, we can donate a kidney to others because one kidney functioning well is good enough functioning normally is enough to live normal life. But when the kidney disease progresses to end stage renal failure, you need dialysis and transplantation. Next, as for the treatment, in the treatment of disease, you treat the primary disease which causes the kidney damage, like diabetes, hypertension, glomerulonephritis, and other things which I listed earlier. And people ask me, what is a special drug to treat the kidney disease? Do you have any drugs? You are giving diabetic drugs, you are giving BP drugs, you are telling me salt this and that. Is there any special tablet to make the kidney normal? If you ask me that, unfortunately, there is no such thing. Unless we replace the kidney, we cannot. So I am sorry to put that term and that, as that, but you have to be realistic about the thing. But what is important is we have treatment, pre-dialysis monitoring, and control symptoms. Very important is control diabetes. Keep the blood sugar, your HbA1c below 7 all the time, not one day, not 1 month or 1 year. All the time, check your blood sugar, take appropriate medicines. Enormous medicines are available. You take it properly, and of course, you get tired taking medicines, but keep taking it and keep your blood sugar, that is HbA1c is an average, 3 months average of blood sugar. It should be less than 7. And keep your blood pressure under control. It should be kept below 130 by 80 in a young person. Older person above 60, you can go up to 140, 90. There are large number of medicines available to bring down the blood. And but a basic disease, that is glomerulonephritis, variety of disease, we use what is called ARV-ACE, that is angiotensin receptor blocker. That we give for majority of the primary glomerulonephritis, along with the other drugs, immunosuppressives and other things. That's a big text. We cannot tell that. Basic disease must be treated, and many of the kidney problem, kidney failure affects your bones also. That we call it renal bone disease due to calcium deficiency, vitamin D deficiency. So that has to be corrected. As I told, anemia is a part of kidney disease. The hemoglobin comes down. Anemia is the reason for your loss of appetite and tiredness, etc. And to prevent that, you have to treat anemia with a drug called erythropoietin that is produced by the kidney. A diseased kidney does not produce adequate erythropoietin, so we can decrease that. And all this not possible when this in control and the patient progress to end stage renal failure with a kidney function of 15 ml of GFR, they have to go for what is called a renal replacement therapy. It's otherwise dialysis or renal transplantation. Next, dialysis means we use a dialysis machine and an artificial kidney or filter to remove the waste products from the blood. And there are two types. One is hemodialysis, that is, whether I don't know whether you have seen, that is where your blood goes into the machine and the filter, the artificial kidney filters, removes all the waste products, and this is the hemodialysis. This is the machine. This is the artificial kidney. The blood goes from your system into this kidney. It removes all the waste products and it returns back into your body system with the clean blood. I can see what the sorry. Back to the machine. Back to the this is the monitor. This machine is important because during dialysis, this happens. It keeps your blood flow adequate. It sees that you are adequately removed, the waste products are removed, your blood pressure are monitored, and it's not clotted. When the blood comes out, it immediately clots. It is not allowed to clot. If it clots, the whole thing is waste. So all these are monitored by this machine. It's a hemodialysis machine. This is a kidney or filter, we call it, and this is uh, vascular access from where the blood comes to the body, to the kidney, and then returns to the system. Next, peritoneal dialysis. Both of them work on similar principle. That is, remove of the solute or water across the semi-permeable membrane. It's called dialysis membrane. In the peritoneal dialysis, can you back? Next one. Next one. Next. In this, our body membrane itself, in the abdomen, we have our intestines are covered by a membrane called peritoneum. It's a natural membrane, and that is used for dialysis. And this abdomen peritoneum dialysis PD is accessed by a catheter called PD catheter. It's a soft plastic catheter, and the catheter fluid goes into the abdomen, and and it can be hidden behind the clothes, and the fluid comes out. It is very suitable for people who don't want to go to. It's done at home by the patient himself. It's the commonest way of dialysis in places like Mexico, Hong Kong, etc., where patients are busy, not able to go to the hospital for dialysis, and they can do it at home. But you cannot be doing for people who cannot manage themselves, unable to take care of self, and cannot be done. How it is done? Next slide. Oh, this is the abdomen. You can see, and this is the catheter put in. The catheter you can see inside the abdomen comes out through this, and the fluid dialysis solution comes in a bag, goes into the abdomen, and stays there. You remove that catheter and you go about. After 6 hours, you come. It's in the abdominal cavity where the unwanted substances are removed by the peritoneum, and after 6 hours, you connect to your bag, and you can do that by yourself, and that comes out. Then in the same thing, and you can put the next bag. So 3 times a day you have to do it every 6 hours, and that can be done at home. And now we have machines which can be done used in the night. You can go for work and come back and connect it to the thing, and the bag continuously sends the fluid into the abdomen, drains it out, and you time it, and everything is adjusted. And morning you get out of the bed, along with it you disconnect, and you can go back for work. This is called continuous ambulatory peritoneal dialysis, shortly called as CAPD. Go next. Next slide. So this is how it is done. This is the bag. There are two bags here. Here one. And this bag contains the fluid. It goes inside. You disconnect, and then after 6 hours, you come and drain it out in this bag and put it into the abdomen. Disconnect, throw the bag into the dustbin, and you can walk away and go for work and all things, and come back after 6 hours and do it. And it can be done at home in a clean surroundings. This is very popular in people, younger people, and people who can do themselves these work. But in India, it is very, one thing is more expensive than hemodialysis, and people are afraid to do themselves, and they don't take care of themselves. Do it, and their relatives have to do it, and very often they don't have the support. So this we also do nowadays for people. For many people do it, and for this we have a machine also that you connect the machine to this catheter, which is inside your shirt. Then connect it to the machine. The machine every hour pushes the fluid, drains it out, pushes every 6 hours, and does it on 6 hours. And morning, sorry, you can disconnect it and go about by work. This is another way of cleansing your blood due to renal failure. Next, next. The best thing for kidney failure patient is called what is called kidney transplant. The diseased kidney, totally failed kidney, looks like this: shrunken, nodular, and fibrous. And you put a new kidney. Somebody has to donate the kidney. who I'll tell you next. And the kidney can be
Yeah.
okay.
Oh, okay, okay.
Okay. This
Yeah,
is next option. No, go to the previous one. Previous.
yeah, yeah.
So kidney transplant means you put a new. It's another way of treating kidney failure patient. The best way, if you can afford, if you can get it. Somebody has to donate a kidney. Now we use what is called deceased donor transplantation. That means kidney can be taken from the dead persons, cadaver persons. We used to call it cadaver transplant. Now we call it deceased donor transplant. And one person can donate two kidneys. And if that family has to give permission to remove the kidney, and that can be implanted into the patient who is ready for the kidney transplantation. This is the transplanted kidney. Artery and vein are connected, and the ureter is connected to the bladder, and the patient passes urine. If you can get it, that's the best way to treat it. That's almost the patient goes to a normal state. Because when you do dialysis, you only replace the one aspect of kidney function, that is removing the waste products from the body. Whereas when you put a new kidney, it completely replaces all the function of the kidney. For this, somebody has to give kidney. What is kidney donation? Next slide.
Could you please share us and what is kidney transplantation and how do we understand by organ donation?
Organ. You know. See, organs can be donated. Some organs can be donated by a living person. Almost all organs can be donated by someone. Oh,
Yeah, it went back.
there's an extra. Okay, someone.
Yeah, no, no, it went back. So yeah, it came to this slide. Yes, sir.
Almost all organs can be donated by someone who is deceased, and this has to reach the recipient within few hours after the donor's death. In case of live donation, the donor should give his consent. In case of cadaver donation, relatives need to provide consent. When we say next, there are two types of kidney donation. That is live donation. I told you. In our country, majority of or due to live donor in Western countries, majority are called cadaver or deceased donor transplantation. In this, no waiting period, less time and dialysis. That's a live donation. But needs from your family members, somebody has to donate it. And blood group must be same. And patient, the donating people person must be absolutely normal. No disease, no problem. They may be related, same blood group, and most willing. They should not, you cannot buy a kidney. The days are gone when people used to buy kidney. That is illegal at present. It's completely banned by the government law. So it must be most willing and given willingly given without any expectation. That is a live donor transplantation. Cadaver means dead person, but not totally dead. The dead person must be a normal person. So how only a normal person die, road traffic accident persons. So they are the donors, not people who die every day with diabetes, heart attack. All those people have diseased kidneys. So we don't take we cannot, every dying person cannot give a kidney. I'm only patient, people who are normal in health. Usually it is only the uh, road traffic accident fellows, young fellows, rash drivers who die on the road traffic accident, whose heart must be functioning. That is the caveat in cadaver donation. They are neurologically dead. They are totally dead, but the heart may be functioning due to ventilator, other supports. It may be drugs. It will be working, but they are totally gone. That has to be proved by many tests that this patient's brain will not recover. He will not recover. There's a group of people for that to certify brain death, and the patient heart may be functioning with a support system like ventilators and drugs. And The blood group must match, and it is put. There is a, we have what is called Tamil Nadu transplant program set up, and they have the all the people who are being listed for the with the kidney failure and the blood group and the age, address, everything is there. And as soon as a person willing to give kidney, the family has to give consent, and they so like they match the kidney. Who can get the kidney? There is a separate organization by the government of Tamil Nadu all over each state, formulated by the central government rules, and it is matched and it is immediately given to the told the family members the deceased renal failure patient, and they have to come and get the kidney. That is a process, but well organized right now in our state. And our state was and Andhra the leading states with the deceased donor transplantation. But last 2 years we are not able to do because of the corona COVID disease, because we cannot take a kidney from a patient who dies. We don't know the person who dies whether he has a COVID disease or not. Nobody was willing to do the COVID test for a patient in the last 2 years. Now it is started again. Next, next question.
Yeah.
So, what can you donate when you are alive?
Yeah.
If you are a live donor, can donate three things.
1 second. Yes.
One is
Yeah.
you can donate blood. You can give kidney, one kidney, as I told you, because if you are perfectly both the kidneys work, you can donate one. And now they take liver also. A part of the liver is taken and transplanted. Only these three things are donated. Next, in a body donation, that is, each cadaver, that dead person can donate organs which 50% can be benefited. And if you ask me how many done in our country, in our state, next,
How much
you want
organ
to know this
donation in Tamil Nadu?
in
Yes.
Tamil Nadu. Okay.
Yes. Yes.
This is 2 years ago, and these are the organs donated by cadaver donation in Tamil Nadu. Kidney 30.4%, cornea 25%, liver 15.5%, heart valves, heart, lung, bone, skin, pancreas, and everything can be donated. And I do. So when we die, we will live in about 50 people donating all the organs, provided we die healthy. So that is the organ donation. And the important thing is, when we are alive, we don't know what will happen because nobody can predict death. Suppose we have to have a card called donor card, because very often the relatives refuse to donate because when they lose the loved ones in a sudden accident or something, they are in a very bad mood, and very few are willing to do. But suppose you carry a donor card, I am willing to donate my organs when I die, and that can be taken as a permission, but not in our country as such. In our country, we still want people, relatives, to give permission because lot of scams and things of unnecessary things, kidneys are stolen, killed, and all that. So we still expect the relatives to give the permission. And that card also available. We can carry it with us. Next question.
Yeah. How should we take care of our kidneys, doctor?
So we are coming. How should we take care of our kidney? That's very, very important. Who are the people at risk for kidney disease? I told you, people with diabetes, people with blood pressure, high blood pressure, family history of kidney disease. If it is some of the family disease, kidney disease can run in the family. If you are overweight, if you are a smoker, if your age is above 60 years, and if you belong to certain ethnic groups, particularly Africans, Hispanic, Asians, we are all Asians, we are all more at risk for kidney disease. And people who take alternative medicines, over-the-counter medicine, particularly pain relievers. And people take, across the counter they buy and take it as and when any pain comes, long term. And another tablet now coming, being popular in the last 10 years is pantoprazole, pandosic, what do you call it? Abdominal discomfort, the indigestion tablet, they call it. That seems to produce any problem as well. People take it indiscriminately as long for a long time. So all this has to be taken care of. And your weight must be reduced, you stop smoking and take care of any kidney disease you have, appropriate medicines.
So any golden tips to prevent the kidneys issue, doctor?
I wish I could give, but these are the 8 golden rules of prevention of kidney disease as such. Keep your blood pressure at 130/80. Even if you're a hypertensive patient or even normal patient, keep checking now and then. If you're above 40, keep check your BP. If your age is more than 60 years, the pressure can be kept around 140/90. And medications, but don't take it on your own, like ACE, that is angiotensin inhibitors, receptor inhibitors. They reduce proteinuria. So the reduction of the protein, if you are a kidney disease patient, is important measure to prevent the progression of the disease. And your most important for all of us, particularly Tamilians and Telugu,
Yes, doctor.
it needs salt, but not more than 6 grams. You know how much we are taking? 20 grams a day. All of us take our pickles, peppers, chips, and all the fast food contains lot of salt. And you have to, even from childhood onwards, if you make it a point to reduce your salt in your diet, it's a big way to prevent hypertension, blood pressure, kidney disease, etc. And if you are a diabetic, keep the blood sugar under control, as I told you earlier, and cholesterol must be kept under control. And diet, particularly excessive protein in diet. Nowadays, very popular is the paleo diet, where they take only protein, no carbohydrate and nothing. They take at least 100 grams, 120 grams of protein. That's not needed. And excessive protein intake can harm the kidney. That is, people, sports person, people very conscious about your figure and want to develop muscles. They are all advised to take a lot of protein in bodybuilders. They have a risk of kidney disease. And smokers, definitely. And smoking is harmful not only to the heart and lung and cancer, it is harmful to the kidney also. And sedentary life, sitting all the time, watching TV, WhatsApp, and computers, all that, if you don't have enough physical activity, your blood flow to the various organs will be less. So that is how most of, not only kidney, many organs will develop. And your weight must be kept at the right. Your BMI must be 25 to 27. So these are the some of the golden rules to prevent kidney disease in our patients.
Yeah. So final few questions I have, doctor. I would like to quickly read it out for you. What symptoms do usually appear if person gets a stone in the kidney, and how we can proactively avoid it?
So the stones in the kidney, once in these stones can be hereditary. In a family, if you see some of the people have stone diseases, we call renal stone diseases, can be genetic. The father passes stones and children, 1 or 2 children may form. Because they have a defect in throwing out the uh, calcium phosphate into the urine, dissolving that. And that is a genetic. These people have a family history of stone. If the stones are small, very mild, they may be asymptomatic. It may be discovered if your routine use of ultrasound. You can find few stones in the kidney and then you may come. But once stones become bigger, start moving from the kidney down, you develop severe pain. The pain on your loin, loin at the back, and the pain will radiate towards your genital area. That is one of the very common symptom of a moving stone. And and the stone pain is sometimes described as equal to the delivery pain. When patients, people who deliver pregnancy, they have understood that kind of severe pain. Then only very often people come to the doctor unless they find it out in a routine checkup. And sometimes the stone may be silent and the blood. You may see, suddenly you see some blood in the urine, red color urine, and immediately if you do the test, one of the cause of symptoms of stone disease. And it can be avoided if you are known as a you have a kidney stone and it is diagnosed. You have to avoid certain food like taking coffee, tea, chocolates, greens, particularly spinach. Spinach that can they are contain a lot of oxalates. What does a stone contain in is calcium, oxalate, uric acid. These are the main ingredients of the stone. So these food contain a lot of it, particularly mutton.
Okay.
Mutton contains a lot of uric acid, oxalates, and the calcium. That when it passes, and if you are a stone producer, easily. So once you are diagnosed with stone, avoid these things and take lot of water. 3 liters, 3 to 4 liters of water. Principally, primarily RO water, because your borewell or well water contains salts like oxalate and calcium. And some areas like in Andhra Pradesh, the content of oxalates and stone, uric, oxalates and calcium are more in the groundwater. So preferably avoid that and use RO water removes all these salts from the water. So better use that. Take lot of water, and if there are pain, there are drugs. Immediately go to your doctor and take that. If there is stone to dissolve, if the stone is less than 8 millimeter size, we can dissolve it with certain medicines, and 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 you have to keep checking. So once it is removed, people forget it. Until next time, they get
Yes.
the pain. So you keep checking every year on ultrasound if the stone is there. Earlier period, if it is less than 8 millimeters, you can easily dissolve. But when it's become more bigger and blocking, you need to treat it either surgically, but we have now lithotripsy called the stone breaker and removal. Without surgery, you can do that. So better
Thank
you can avoid
you.
if particularly your family has stones.
Yeah. Thank you, doctor. In India, we are rich with the vegetables and fruits. Isn't it good to take any seasonal fruits for a person who goes through a kidney problem?
If normally you can take all fruits, if you're a diabetic, avoid bananas and very sweet fruit like mangoes, bananas, and all those things can be avoided. But when you have a kidney problem, when your kidney functions less, certain drugs we take for kidney disease may increase your serum potassium level. Raw vegetables, cooked vegetables, no, raw vegetables and fruits contain lot of potassium. And certain fruits contain extraordinarily high nuts, for example, nuts, dates, and fruits like pomegranate, all contain lot of potassium. And better to avoid all those. If your potassium is normal, you can take all fruits. If your sugar is abnormal, you should avoid certain fruits like high sugar content like mangoes, bananas, uh, jackfruits, and all those things. But if the potassium is high, better to avoid most of the fruits except we allow them papaya and guava and what is that pineapple, all those things.
Thank
And
you.
that is you have to the doctor has to tell you what fruit to avoid if you have kidney problem. Otherwise, take vegetables and fruits. No
Yes.
problem.
Yes. Can frequent urination will lead to kidney failure, doctor? Or is it a myth or is it a reality?
Frequent urination can occur in many situations, particularly elderly people have frequent urination. Men with elderly men have what's called prostate enlargement. They get a lot of frequent urination. And as you get older, your bladder may do overacting, do like that, and you feel like passing more urine, and they don't go to renal failure. And frequent urination, by and large, you find out the cause for that, usually don't lead to kidney failure. But it may be due to some other disease like bladder function, etc.
Yeah, thanks, doctor. In modern lifestyle, people are stressed with work and people take more junk food or fast food. What's the best advice from your side, doctor?
The one good advice is avoid.
What?
Avoid as far as possible junk food and fast food. Because junk food, fast food with a lot of cheese and other things contains a lot of salt, lot of oil, that is lipase, cholesterol, etc. And carbohydrates, if it is sweets, all that are unnecessarily large amount and it should not be taken unless it is very once in a way you can take, but not regular junk food. One of the cause for obesity in our country is junk food. Young children with obesity, particularly the school kids and college kids, they go in for that, and that should be avoided as far as possible. Simple home cooked Indian food is good to keep your kidneys safe as well. And any even heart, even for heart disease, junk food is not good. And to reduce weight, you have to avoid junk food.
Yes,
So best to avoid all that unless absolutely necessary.
yes, doctor. So one question came in the pink, doctor. So it asked that actually marriage life after transplant, how it will be.
The average Indian transplant patient live without much problem for 10 years without any problems. After that, they may develop, or some I have people who live 20 years, 25 years with a transplanted kidney. They can marry, provided you tell your spouse that would be whether male or female that you have a kidney disease. Because some of them hide it and then it's not good. But you can marry, have children. Women, usually we tell them after if your kidney transplanted kidney function normal, you can become pregnant and have one or two kids. When there is no such problem, they can procreate well after the transplant. Actually, sexual function get accelerated after transplant. So only thing to remember that kidney after 10 or 12 years of transplant may get rejected by the body. So that has to be kept in mind going for a baby. If you are young, you can do that. No, pregnancy is not contraindicated, and you have to think the pros and cons and your family situation, everything, and you can marry and have kids, men
Yes,
or women, in period. That's
thank
the
you.
advantage of transplant, not dialysis.
Yes, yes, yes. So that's it. And please do share your golden tips to remember as a note so that every viewers can understand and have those things in their daily life, doctor.
I think I told you already the golden tips.
Yes,
That
yes,
one thing, keep your body weight, have a healthy life. When you are young, be very active, have some sport besides your studies. Don't sit all the time watching TV, and that TV and WhatsApp has made a big difference in our personal life.
yes,
Reduce it, whether young or old, and eat healthy food
yes,
like cooked food with less salt and avoid salt. Reduce salt because I told you we in Tamil Nadu and South Indians take more salt than North Indians, and that leads to a lot of this. And reduce sweets. If you ask me, If people put a ban on these liquor shops, they must put a ban on the sweet shops also. Not
Yes, sir.
in a city, only two or three sweet shops must be available. But now you see every street has a sweet shop, and every time we go, we buy sweets to give it to people and avoid that. Give fruits. When you go and visit your relative, take fruits and vegetables if
Very
possible.
golden tips,
No
doctor.
sweets. That, I mean, day to day lifestyle, you have to do that. And keep active, learn one sport, active sports, not carom, but play any sports you do that from small.
Yeah.
And keep your weight under control. Avoid smoking. Drinks you can take once in a way, no harm. Drinks per se, do not, I don't want to tell that, but if you take in moderation, there's no problem. And eat good food. Oh, don't overeat. Keep active and avoid salt and sweets. Reduce as much as possible. That will keep you healthy and well.
Yeah, sure, sure, doctor. So thank you so much, doctor. Such a wonderful discussion we had, and you have shared a lot of golden tips with us. We had a very wonderful piece of information with you, doctor. So much. Thank you so much for all your time, and you have in your busy schedule. Still, you accommodated for us, and thank you so much, doctor. And I'm very very glad, and I'm sure that all our participants will be more than happy to go through those resources which you have shared in the form of video, doctor. So thank you so
Thank you,
much.
Abroy,
Yeah.
for giving me this opportunity. I hope it is useful for people and people understand and also follow the change their lifestyle so that we can prevent. This is called non-communicable disease. That should be there's increasing day by day that we can reduce if we spread the message about saving the kidney. Thank you very much for the opportunity.
Thank you so much, doctor. Have a great day, doctor. Thank you so much once
Thank you.
again.